My story. So I first started as a nurse in 1993, and I had a few experiences working as staff at a couple of different hospitals, and I had been working a little part-time with agencies, and I had a couple of bad experiences as a nurse going to a new facility through an agency. And with that experience in mind, I said to myself, there has to be a better way of nurses to be able to go to new facilities through an agency and to be able to function comfortably and safely for their license. And I felt that there had to be a better way. So I started researching, and I found that staffing agencies could be run differently. So I decided that I was going to become an entrepreneur and to start my own company. So I researched and figured out how to do that. And my company, Caring Nurses Staffing Agency, was created in 2012. So we function as an outside resource for hospitals and facilities so that nurses can have either part-time, full-time, or travel contracts. And it has worked very well because, coming from a nursing perspective, I try to make sure that the nurses have the experience to be able to go to a new facility, have their orientation, and be able to function very well at that facility to work with their team. So they are an outside resource, but they become part of the team, and very often they are there for a long period of time. So it can start off as part-time, but sometimes it's actually full-time, and they become part of the team. They integrate very well. The question of recruiting. I have been a nurse for over 30 years, and I have worked in many different hospitals. So in that time, I have been able to work with many different nurses, physicians, nursing assistants. So my network of these people is pretty vast at this point. So in terms of being able to recruit, that actually isn't much of a problem for many reasons. People come to me when I put a job on one of my social media posts. Very often I will get somebody who says, "Oh, I know somebody. And that is the best way to recruit, in my opinion, because I already know the people that I've worked with, and if they are going to refer somebody to me, I know that they are a strong clinician and that they will do a very good job. So that's where my recruitment starts. And it's been very successful. I've had many people come to me over the years, and it's been an amazing experience. One of the things that I really want people to know about how I run Caring Nurses is that relationships are extremely important to me. I don't want to just provide numbers to facilities. I don't want to provide nurses that aren't going to have the experience that they should. And that's the biggest takeaway that I have with the experience that I had when I was a young nurse. So the managers, the HR people, all of the people that I come in contact with my contracts, I make sure that we create a transparent relationship so that we continue to communicate well together if there are any issues or problems, or if there are any positive aspects of a nurse or a nursing assistant going to a facility. So I make sure that I am the one that handles all of that. I don't have 10, 20 recruiters. I don't have a million nurses, but we have a very small local company that functions incredibly well for the facilities that we work. My goals for the agency are to continue to provide exceptional healthcare professionals for the facilities that I staff. as well as creating more opportunities for the nurses. So increasing the amount of facilities and making sure that I never compromise our quality for quantity. We are caring nurses, and that is who we are.